to protect the people. To date, we are still a COVID-19 contained country, and thus acknowledgement must be directed to its due. Mr. Speaker, so on that note, I wish to acknowledge and thank our hardworking frontline workers in our battle against COVID-19, the healthcare workers, Fiji Police Force, Royal Fiji Military Force, NGOs, and special appreciation and recognition to our development partner whose assistance and generous donation enable us to effectively fight and contain COVID-19. Their resilience, dedication, and sacrifice must be recognized and commended. However, Mr. Speaker, sir, while we are being designated as a COVID-19 contained country, is commendable, we are by no means out of the woods yet, as this pandemic still poses a clear and present danger to the lives of our people. This is underscored by the quarantine of 25 border workers and officials in Lautoka over the weekend and discovery of 2 new cases. I'm glad to see the Permanent Secretary for Health and his team are on alert to minimize the risks of local transmissions, which can be fatal. It is critical that we as leaders, every individual, realize that we all have a role to play to maintain our current status with COVID-19 so that the hard work of those in the front line is not in vain, and that is follow the rule of law, adhere to the advice of the Ministry of Health and Medical Services. Mr. Speaker, sir, COVID-19 pandemic has not only become a public health crisis, but also affected the economy. Here in Fiji, we are no different. There are job losses, close of business, more and more people facing unprecedented hardships. Today, more than 60% of our populations are struggling for basic needs. Mr. Speaker, sir, I wish to take this time to give thanks to our Lord and Savior for his blessings and protection. I would also like to thank our aviation industry during these trying times of managing the risks in the continuation of services for cargo, both import and export, and repatriation of Fiji citizens back to their homeland. The opening of our ports of entry is essential for necessary and essential goods to be brought in and export for our earnings. So while authorities do their part, the rest of the nation must remain vigilant and alert and abide by the protective guidelines and advice from the Ministry of Health to maintain our status. We all remember what was it like during the early stages of the pandemic, lockdowns and restrictions, and what that brought about in our various localities and settings. And I'm sure we wouldn't want to go through that again. The festive season is coming up, and mass movement of people will follow. And we should all adhere to the advice and protocols so that it will be good for us. On that note, Mr. Speaker, I urge the government and the Ministry of Health and Medical Services to continue to ensure full and proper PPEs are made available to our frontline workers. Ensure our frontline workers are properly remunerated for their overtime work. Ensure that those who plan to be repatriated or visit Fiji undertake testing. We continue to receive border cases and begs the question of the credibility testing from other countries. Ensure that strict protocols are followed by those in the front line to minimize the risks of infection. Ensure that those that are being quarantined follow strict guidelines with regards to their respective isolation and definitely no special treatment. Ensure the media release is on time and on point to counter fake news. The recent media release by the Permanent Secretary for the Ministry of Health and Medical Services with regards to the recent scare was well articulated and timely. And to ensure our testing facility continue to be credible. Mr. Speaker, sir, while we seem to have control over COVID-19 in Fiji, the burden of other diseases and infections continue to affect us. Non-communicable diseases, infectious diseases, cancer, circulatory and respiratory illness, etc., continue to contribute to morbidity and mortality. Mr. Speaker, sir, prior to COVID-19, the Honourable Minister of Health and Medical Services had mentioned some of the achievements in this August House, such as opening of new nursing stations, health centres, divisional hospitals, public-private partnership with ASPEN to operate Lautoka and Bar Hospital, patient-doctor ratio improving, the new medical vessel MV Vivueti. Our status of health indicators are above par to WHO and international standards. Medical specialist services, newer model cath lab, decentralized general outpatient and specialist services, dialysis subsidy, to name a few, Mr. Speaker, sir. The achievements are commended, but the quality of service delivery is dependent on the right policies, budgetary support, the right and relevant priorities, and equipping our healthcare workers the tools to carry out their respective services to the best of their abilities. We may put the blame on COVID-19 for now, rightly so, due to its impact and disruption of the supply chain that equips our health system on medication, perishables, and equipment. But most are chronic issues that have been there even before COVID-19 came along, such as debilitated conditions of our nursing stations, health centers, and hospitals need attention. The public-private partnership between ASPEN and FNPF is still not operational. With the Nyumba Hospital, a white elephant that promised so much but has not delivered. Patient-doctor ratio has improved, but I welcome His Excellency the President in addressing a deeper collaboration across the medical field to include general practitioners. And I will elaborate on this later in detail. Medical specialty services without tools, equipment needed to carry out their respective work is just lip services. Specialty services, is informed to me by a colleague, are operating daily on a miracle with case by case. The increase in numbers attending the decentralized services, but only to be told that further treatment or pharmacy to come from the patient's own pocket. Shortage of medication supply, especially essential perishable, is a chronic issue and even made worse with the COVID-19 pandemic. I had mentioned this before in that for shift work to be successful, you need capacity within the workforce. The cessation of overtime payment will affect performance when staff are overworked, fatigued, and mistakes can occur. Mr. Speaker, sir, I look forward to the Honourable Minister of Health and Medical Services in addressing the chronic issues. Mr. Speaker, sir, His Excellency also touched on general practitioners in private practice, joining the forefront in addressing every health challenge Fijians face, and this is commended. The primary healthcare teams from the public and private sectors maintain no formal relationships. General practice complement the state's PHC services. Planning and coordinating public-private sector services and program delivery has been slow and delayed. The need to roll out an interactive system and not run parallel is needed with commonality in program outputs. Fiji College of General Practitioners now runs its own conferences, workshops, training for its members. A mentorship program exists for new trainees with established pathways to full membership and adequate annual accreditation in licensing. Research is encouraged and regular quarterly publication is established and operational. Some of the barriers of implementing community-based primary health care services can be physical restraints, primary health care health delivery in both sectors, poor referral and reporting systems, digital technology poorly developed, feedback very rudimentary to primary health care from public primary health care. Public health awareness and health literacy might be very poor. Primary health care is the foundation of health and well-being and socio-economic development in society. Continuity of care is needed, especially with current poor palliative care for non-communicable disease complications, cancer patients, and those with disabilities in the community. There is even a greater need for health screening and health promotion. The vital interconnectivity of primary health care and public systems are long overdue. The use of digital technology, remuneration options for private sector in the primary health care needs addressing before the private sector goes into bankruptcy and private health care is overwhelmed and totally dysfunctional. Mr. Speaker, sir, allow me to turn to issues within my constituency. I thank the initiative by the government sector in Tabuini, especially the Fiji Police Force, in collaboration with the Vanua, for promoting sports to combat crime. The Waimbula crossing upgrade is ongoing, and upon its completion will ease the burden of travelling to the North Tabuini. Kanakana seawall in the Tikin of Tunloa needs feedback on its progress and also the need for seawall to protect the boundaries of the school in Nevada, south of Tabuini. Permanent water source at the south of Tabuini needs continuous addressing. Mr. Speaker, as a member of the Lord, Mr. Speaker, I have endeavoured over the last 2 years of my term to commend government on its progress while identifying areas of improvement. And I have joined the former Honourable Leader of Opposition in offering our friendship and cooperation across the aisle to work on the many challenges that face our nation. On that note, sir, I wish to commend and thank the and thank and honor the former Leader of Opposition, Honorable Major General Sithiben Rumbuka, for his courage and leadership at the helm of SEDELPA the last 4 years and over the last 2 as my parliamentary opposition leader. I have been inspired by him. I have been fortunate to learn from him. I wish him success, and there, no doubt, will continue to play a role in national leadership. While we, as the loyal opposition, led by Honorable Major General, offered our hands in friendship and cooperation across the aisle, this was unfortunately rebuffed. I am therefore thankful that he has sacrificed his position to perhaps give government the opportunity to cooperate across the aisle. In closing, Mr. Speaker, sir, I respectfully commend His Excellency's address and look forward to another parliamentary session that may yield more relief for suffering people of Fiji, and I thank you for the opportunity, sir.
I thank the Honourable Ratu Atonio Lalabalavu for his contribution to the debate. Honourable members, I now call on the Leader of the Opposition, the Honourable Ratu Lalabalavu. You have the floor, sir.
Thank you, Mr. Speaker, sir.